Hey y'all, whether it's morning, evening, or afternoon, I'm just glad that you guys had decided to vibe with E. Yes, the one and only E. Hey y'all, I hope y'all are feeling amazing, doing amazing, and just being amazing overall. And if not, it's okay. Your time is coming soon, my friend. Remember, bedtimes don't last forever. After every storm, there is a rainbow at the end. Okay? So, without further ado, welcome you all today to the fourth week of the month. We are literally almost in that time of the year, the most wonderful time of the year at that, to celebrate all the amazing holidays, get into the traditions, and so on and so on. But without further ado, if you're new here, welcome. And for the ones that are not new to this but true to this, hey y'all, what's up? What's popping? And I hope once again you all are doing amazing, feeling amazing, just been amazing. If not, it's okay. Your time is coming. These bad times don't last forever, but we need them so we can look back on them and be like, dang, it's all coming together now. So, without further ado, I want you all to sit back, relax, and enjoy hearing my voice. Whether you're on the go or you're just, relaxing, doing what you're doing, I want you to turn up whatever, how you listen to me. Turn up your laptop, turn up your phone, turn them AirPods up, them beats, the pills, Alexas, the car radios, whatever. Turn me up because today's vibe of the day is very important and it's also in honor of October. And it's it's like I think you should know, but if not, it's okay. I'm gonna get into it in a few seconds. 5, 4, 3, 2, 1. So the vibe of the day is Breast Cancer Awareness Month. I was going to talk about National Bullying Prevention Month, but I already talked about it. Um, I already talked about it last year. So I will say that October is known for National Bullying Prevention Month, and also Breast Cancer Awareness Month as well. So for the ones out there that know somebody that has breast cancer or who had breast cancer, and you survived or who didn't survive, shout out to you. But most of all, shout out to the ones that survived, because that is a really sticky situation. But shout out to the ones that also is out there willing to make a difference for the people that we may have lost, as well as the ones that are dealing with it now. If you have lost somebody due to breast cancer, I'm so sorry. My heart go out to you, because it's a very touchy subject. I'll never forget when I went to my first ever breast cancer. I did my first ever breast cancer walk, and I loved it a lot. Hopefully, I will do another one again this year, because usually they will have it, I think, up until before Halloween, I'm guessing. I'm not sure, but I did one, I think it was 2 years ago, and it was really good. And it was like near my neighborhood, so, well, not too far from my neighborhood, but it was really nice. Being a part of activities that involve with breast cancer is very nice, and it's also a way for us females to learn, because those are one of the common things that us women deal with, that at times we don't know that we have. That's why it's also best for us to, do what we have to do so we can prevent that from happening. Also, my university and other universities, programs, organizations, things like that, they do things in honor of breast cancer. I'll never forget last year when I was a part of an organization at my school. We designed bras or t-shirts in honor of breast cancer awareness. And the when the bra that I designed, I'm looking at it right now, I think me and one of the girls that was in the group with me and her became really cool. We wrote on ours, one side is the breast cancer symbol, and then on the other side it says faith. Because like I said, shout out to all the women that have been able to beat breast cancer. And for the ones that have it, you're most definitely going to beat this, because this is something that's not going to last forever. And as also too, even to the women that did have it and lost their lives, they were fighters. Regardless of whatever sickness you go through in life, if it's breast cancer, lung cancer, whatever, people are fighters. And people never give them their flowers while they're here. They always sometimes wait till they're gone, but I'm going to give them their flowers here or not. Because this is a real sticky situation, and it's very deep. But it's also important because within the population for us women, this is very effective. So we have to come together, stick together, be one and give each other nothing but good vibes, peace and blessings and everything, because it's serious. So let's get into it. Who is most affected by breast cancer and who should get screened? So this basically straight up saying like who's affected by it and who should get screened. Automatically women are affected by breast cancer. Women over the age of 50, however, are at the risk of developing breast cancer. Women in their 30s and 40s should also be screened regularly. However, African American women and Hispanic are also at higher risk of developing breast cancer. Women over the age of 50 should get a mammogram every year. Women in their 30s and 40s should get a mammogram every other year. African American and Hispanic women are more likely to be diagnosed with breast cancer and should be screened more frequently. As well as women with a family history of breast cancer should also be screened regularly. Women with dense breast tissue should also get screened more frequently as well. So, with that being said, for example, women with a first degree relative with breast cancer should get a mammogram every year starting at the age of 50. So, if you're new here, I did speak on women's health. And one of the things that's really, really, really the number one for us, well, the number one is breast cancer, and I think it's breast cancer, and I think it's I just had it on the top of my tongue, but I know for a fact breast cancer was the number one, and then I think it is high blood pressure. And I think it's number one for men. High blood pressure, I think it's number one for men, but it's number two for women, and breast cancer is number one for women. So in that episode, I talked about how, like, us women, we need to really, really pay attention to our bodies and notice the signs. Because if we don't tell ourselves, we need a break. Our bodies want to tell us before we even say it out our mouths. So that's why it's very important to get the regular checkups, get the screens and make sure everything's okay. Especially if you do have a history of things like this, any type of sickness or things like that, and it runs so heavily. And when they say relative, they mean like a sister, grandmother, or your mom had it, somebody that's really close to you and have it. Get it done ASAP, and it has to be blood related. Unlike, it can't be kinship, like it can't be your aunt's, you can't be your mom's best friend, because like she's your aunt but she's not like blood related, y'all don't share the same DNA. But also too, if things like that happen, if you get encouraged, you see she went to the doctor and she went to school, and then get the test done, get it done. However, I can't get it done right now, I'm young. But if in the sense of someone like one of my female relatives had it, then I probably would maybe have to get it, but they probably would make me wait, you know. But nevertheless, y'all, please get them screenings, do the mammograms, even do the self-testing in the shower or after the shower, when you wake up, go to bed, because it's very crucial and it's very important. Because like I said, for the ones that are not here with us no more, they fought and they put on a tough fight until they were able to be with who they believe in. And to the ones that were able to fight it and are air and still fighting it, it's important to do it. Look at them and do it, because it's scary. Yes, it's scary, but it's important because it's a part of us. It's a part of being a woman. Having breasts, you got to make sure that not only just if that's okay, you got to make sure your stomach, lips, hips, thighs, everything is okay. But the main thing they also want us to pay attention to is breast, because breast cancer is very high and it's a very, very serious sickness. So, with that being said, therefore, it is important for all women to be aware of their risk factors and to get regular screenings for breast cancer. Okay? So, what are the early signs and symptoms of breast cancer to watch for? So, this is basically saying, like, what are the symptoms of breast cancer and the early signs, so you can, detect it from it being a long term. So, common signs and symptoms of breast cancer include a lump in the breast. They always say that. That's why they also tell you to take, do your own home test, touch, all that stuff, the circles and things like that. Um, change in the side or shape of the breast, a nipple change, a nipple discharge, sorry, and changes in the skin of the breast. Any change in any of these signs and symptoms should be checked by a doctor. Early detectives and diagnosis breast cancer increases the likelihood of successful treatment. These signs or symptoms should be checked with the doctor immediately. Women over the age of 40 should be especially aware of any change in their breast tissues. Regular mammograms can help detect breast cancer in its early stages. Early detection, detective and diagnosis are crucial to ensure that breast cancer can be treated successfully. Regular mammograms can help to detect breast cancer before it causes any symptoms and can be the difference between life and death. So, for example, if a woman notices a lump in her breast, she should make an appointment with a doctor as soon as possible to check it out. So, therefore, it's essential to have a regular mammogram as early detective is essential to beating breast cancer. So, you will be hearing mammograms a lot because that's the key thing that they use to see what's going on. And I never dealt with it deeds, but I can't say never because I haven't done that yet. I'm not at that age yet. But I have heard about it, seen, heard people do interviews, even heard from my mom and stuff on, what it is. And a lot of times people be like, it's a pinch because they putting the pressure and stuff on you and things like that. But at the end of the day, the whole purpose is to make sure that you're okay. So, like I said, too, I did one on health as well with my own experience. If, like I said, too, if you don't notice it, your body will notice it before you even had the right to say you notice it. And the sooner you feel it, the sooner you should get it checked out because you never know how big that little sharp pain can get. You never know how big that sharp pain will continue XYZ. So any feeling that you have, no matter how small you think it is or others may think it is, you never know how big it can go, as well as bumps, pimples, lumps, anything. Get it checked out immediately because you never know what it can do. And the earlier you catch it, the earlier you're able to stop yourself from, dealing with things like that. However, at times, there's a 50-50 chance that even if you do the early detective and trying to see if you can get it done or not. Sometimes it's impossible, but the goal, like I say, is to make sure it's not to take it out. Maybe it's so that it's able to be taken out. So you're able to catch it and you don't have to worry about it. Because with like I said, within this situation with breast cancer for us women, this is very serious. And like I said, I'm gonna use the women that had it because they're warriors. They survive. Regardless if they're here or not. They put on a good fight. And I salute all the women out there, even the ones that are not here that had to put up with that fight because it's serious and us we take things for granted and we need to really do it, especially getting that checkup, getting them regular checkups and making sure we're okay because this is our life. We only get one life and we want to live it to the fullest. And you know, like they say, health is wealth, and it is. You want to get up in the morning, you want to feel good. You don't want to get up in the morning and you can't move your legs. So do everything in your power to make sure that you're healthy. Get them regular checkups, them 6 months, a year, whatever. Physicals, dentals, vision, mammograms, testing. Get it done. Because your life matters. And get it while you're young. Get it while you're supposed to get it. So if you're 30, 40 years old or whatever, get it done. Get it done. Get the mammograms, everything done. So get it done while you can. As well as when it comes to when should individuals start getting regular mammograms or screenings. So what this saying is like how often should you get it and when should they start getting it. So women should start getting regular mammograms at the age of 40. However, women at higher risk of developing breast cancer should talk to their doctor about starting early. So, with that being said, like I mentioned too, if it runs in your family deep on like the female side of your family from your mom, maybe her mom, great grandma, or whatever, the earlier that you get it done, well, let me rephrase it. If they had got it maybe in their early 40s or stuff, you have the potential of probably getting your screening probably in your early 30s or late 20s, because you never know. And sometimes things are different, your body's different, but by that being a very high risk sickness, is need to be checked out, such as like when it comes to diabetes. That's one thing too, that they also do a lot of testing on screenings, as well as high blood pressure, those type of things as well. So the sooner you get it done, look at it, treat it, everything, the sooner you get it done, the sooner you can find out everything. And also, if it's high risk, you should get it as soon as possible. Get checked as soon as possible, so you don't wait until you are that age and then creep up on you. So like I said, just ask a doctor or whatever, talk to a doctor in person or online, because they still have the resources for online, the live chats, the Zooms, the Teams, or whatever they use. Or if y'all want to message or whatever through emails or whatever, get it done. But also ask the questions to make sure you're doing the right thing, so you know what you are preparing for once you step foot into the back room to get screening and a mammogram, and so on and so on. So women should also get regular checkups with their doctors to discuss any other risk factors they may have. So also, not only just with breast cancer, also with like high blood pressure, diabetes, anything like that. Even if it runs in your family very high, I would say get that checked out ASAP, because things like that are very, 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 very important to check up on, to make sure that you don't have it. And like I said, the sooner the better, to make sure that you're okay, you're doing great, and you're taking the precaution steps that you need to take, just in case if anything is to happen or happens. And hopefully we don't want that to happen, but things happen. But that's why they say we have to be careful what we put in our bodies, what we do to our bodies. But sometimes you could be the healthiest person and it still creep up on you, because it's just in your DNA, it's just in your genes, your cells, everything like that. And that's okay, because it's like, it's either one way we're gonna get this over, we're gonna get it done with, or they maybe have other options. You just gotta do what's best for you and make sure that you're doing taking the right steps, and also having a clear mindset. Even though it is triggering, even though it is very stressful, and maybe it could be very a headache, we gotta keep in mind we only have one life to live. We want to live it to the fullest, and we want to have a good time. Because I'm starting to learn that we can't, the things that we can't control, we just have to keep it in whoever hands that's controlling it. And we also have to just wait patiently and see what happens, because our job is to put the work in, do what we got to do. Now it's the expert, their turn to see what they can do, to see if they can help us or not. But I always think positive, and that's to help us in the long run, help you in the long run, help us in the long run, me, all that. Because it's important. I'm gonna keep saying it. You only have one life to live. You want to live it to the fullest, and you want to do all those things that you've been dreaming of. And some people don't let their sicknesses get to them, especially if they're able to still walk around, move around, things like that. So we can't take life for granted, especially within these times and things like that. So we have to appreciate one another, appreciate what we got, but also appreciate what what we have, especially when it comes to technology and the doctors too. Because it's just things that I see and notice, and I be like, and you ever watch old documentaries, things like that, you like, wow, they didn't have this back then, and we have all this now. So we have to take appreciation to the things that we had versus things we didn't have, that can also help us within our health, within the machines, the technology, the doctors, nurses, all that, especially with sometimes even with the medication. So we have to appreciate everything, even though sometimes we don't want to. We had a moment, we've been doctor's office or the pharmacy or whatever. We just have to. We gotta take the good with the bad. We gotta take the bad with the good. We just have to take it day by day. But at the end of the day, whoever you believe in, they know the last say. They have the answer. They know what's in store. So we just have to keep faith, be positive, but also be positive to others, not just ourselves, but also be positive to others. Because I feel as though even if you're going through a dark time and you don't want to tell the people you love, you're going to eventually have to tell them, or they're going to eventually have to know. They're going to notice, especially the women in your family. They'll notice certain stuff that, that most men won't notice in the first round. But especially if it impacts with our health, of course, they're going to be there. A female figure in your life is going to be the one to be like, whoa, help you get yourself together and everything. So when it comes to breast cancer or any other sickness, please get the screening that you need. Please go to the regular checkups and everything like that. Because the sooner you prevent it or whatever the case may be, the sooner you will feel at relief. You'll feel at ease. You'll feel like, okay, I did this. Whatever, the whole 9 yard. The sooner the better. Going to the doctors doesn't make you or break you. It just helps you out and shows that you are willing to see what's going on with your body. Because most people don't. As well as going to the dentist, visual, things like that. We have to, when it comes to self-care too, not just, sometimes just laying around stuff. Sometimes self-care may go to the dentist, the doctor, whatever related with your health, because health is wealth and you need to make sure that you're good, because sometimes people be like, yeah, whoop, and they find out something they don't want to find out. But it's okay, because we all go through that. Someone has gone through that in your life and they didn't know. It's okay. It's a part of life. It's a part of human nature. That's what makes us who we are. We just have to roll with the punches and know what we can do and know what we cannot do in those type of situations. But I always tell people, pray, manifest, do whatever you can on the situation, because this is not your last fight. And it's not your fault that this has happened to you. You just have to do the best of your ability to break it, to break every chain, to break that chain, and you'll be just fine. It takes time. Slow and steady win the race. So you want to take that time to make sure you get everything you need so you'll be all right. Okay? So, early detectives is key to successful treatments. Risk factors that may necessitate early screening includes a family history of breast cancer, particularly in the first degree relatives such as a mother or sister. So like I said, if you have a mother or sister, even a grandmother and stuff that had breast cancer, things like that, please get it checked out ASAP so you know what's going on and what's in store for you. As well as when it comes to genetic mutations like BRCA1 or BRCA2. That is a personal history of breast cancer or having dense breast tissues can increase this risk. So women with these factors should consider as well as consult with their health care provider to determine an appropriate screening schedule. Therefore, it's important for women to be aware of their risk factors and to discuss them with their health provider to determine an appropriate screening schedule, as well as how soon do they need to make sure everything's okay and what procedures do they need to follow, if so, to be ahead and also educate themselves within this process. As well as when it comes to where can people go to get support, information, or screening for breast cancer. So with that being said, ladies, people can go to their health care providers or breast cancer screening center to get support, information, and a screening for breast cancer. Many online resources provide information and support for those affected by breast cancer. People can also, contact a breast cancer hotline or speak to someone about their experience. And additionally, there are support groups available for those affected by breast cancer. These support groups provide a safe space for people to share their thoughts and feelings, to receive support and to receive information and advice from those who have been affected by breast cancer. So for example, the American Cancer Society offers support groups for those affected by breast cancer in all 50 states. Furthermore, these support groups provide an opportunity for individuals to build relationships with others who have gone through similar experiences, providing an invaluable source of comfort and understanding. So, like I said, there are places and people that are out there that are willing to help you. If you know, sometimes if you don't even get the support or you're scared to tell your support system, take the time to go to the sit downs, get the support from breast cancer awareness organizations or companies, or do the hotlines and stuff to talk to somebody to prepare yourself, or even, even to tell your people that you have it, or just to prepare yourself to help you, let it soak in, like, oh, I have it, or whatever the case may be. Because I'll say the one good thing with the pandemic is that the Zoom was very needed for most people, and I'm glad it's still being used to this day, because some people still don't feel comfortable with coming in person, or they come in person is maybe hybrid. Like, okay, I might come in person, but I might stay home and get talk to you about it. But whatever floats your boat, it was also best for the client. You gotta make sure that they're getting the proper treatment that they need, and that you're meeting them halfway, especially within these type of cases, because it's very important and it's very tough to even go through, because like you see it in the movies, you be like, whoa, you thinking about the bad, but you have to wish for the good. You have to keep faith, stay strong, be positive. Sometimes it's even hard, because I know some, like I said, check on the people that check up on you. That's a really thing I had. That's a real big thing that I had expressed last week, because regardless if someone is going through hard times, bad times, little times, good times, I don't care what time they're going through. If someone out there is checking on you or doing the whole 9 yards for you, and you're not doing the same thing, you need to do that for them. Even if they're going through something like this or not, it needs to be done. And we have to give each other grace, and we have to be respectful to each other, because we never know what somebody has going on. And I'm big on don't judge a book by its cover if you haven't had the time to sit down and open that book to understand what's going on. And, get a feel of the book, or the page that you read in the book. If you don't like the page in the book, okay, close it, put it back on the shelf, and leave it where it's at. But if you're interested and you love what you reading, and you here for it, keep reading until you get to the good part. Okay? So we have to support one another, as well as for women from all different race and gender. We have to be there for each other, because this is one thing that we all go through, and we all have to prepare for, is to see if we have it or not. Or we might not even have lost, close friends or family through it. At the end of the day, we have to stay together, be strong, but also we will have our moments where we miss the people that we lost. And that's okay. Have that time. You deserve to grieve. You're human. I don't care if it was 20 years ago. It still hurts you. It's still going to hurt you. It may not hurt you as much, but you want to have your moments where you think and be like, oh my gosh, such as, you know. So we have to give peace when it's due. People saying you got to give credit when it's due, but we also have to give peace when it's due. If somebody's not into it, somebody needs their peace, their space, put peace where it needs to be. Give them their peace, and let them reach out to you. Give them their time, regardless of what anything's going on. But also related to the topic too, within breast cancer, we have to love one another. We have to look out for one another, and we also have to be there for one another, especially when it comes to women. We have to be there, regardless. I don't care. Short, tall, slim, thick, big, whatever, stallion, pony, skinny. I don't care. We all go through these real life problems, and we all need to get the help that we need, and make sure that we're doing all the right things for our bodies, so we can grow old, have a good time, and be able to just live life. But also be able to say that we put on a good fight, and we're going to continue to put on a good fight until we lay down for that fight. Okay? So we have to think positive, stay positive, and be positive for one another. Because I noticed too, we're not positive. And if we don't speak positivity for ourselves, how are we going to help the young generation? You know? So we have to do it. We got to do it. And last but not least, why is Breast Cancer Awareness Month important, and how can it save lives? Breast Cancer Awareness Month is important because it raises awareness of the signs and symptoms of breast cancer, and encourages women to get regular mammograms. This helps to detect breast cancer early, when it is most treatable, and save lives, and reduce them. It also raises funds for research, and provides access to resources for those who may be unable to afford breast cancer screenings or treatments. Additionally, it raises awareness It raises awareness of the importance of early detective and prevention. Early detective is important because it allows doctors to detect and treat cancer in its early stages when the chances of success treatments are highest. And additionally, raising awareness about the importance of early detective and preventing health to ensure that more people are aware of the risk and can take the necessary steps to reduce the chance of developing breast cancer. So, for example, regular self exams and mammograms can help detect breast cancer in its early stages when it's most treatable. By increasing awareness and encouraging people to take action, we can help to save lives. In this way, we can make a difference in the battle against breast cancer. Okay? So, with that being said, to all the women out there that's dealing with it or know someone that's dealing with it or have gone through it, give them love, support them, honor them, give them their flowers, even the ones that's not here, put on a good fight. Give each other their flowers. Love one another, praise on one another, give each other flowers, but also be kind to one another, especially within a time like this. We have to be there. We have to put our best foot forth. Okay? I hope you all have enjoyed this Bible today. I hope you learned a lot from this because it's the whole purpose of it is to learn a lot, as well as understanding what breast cancer is and why is it very important in the month of October. Okay, as well as men as well, because you might have ladies and things like that that go through these issues. So it's important to, you know, learn as you go and also help the women in your life as well. So as always, I wish you guys nothing but the best. I hope you guys enjoyed as well, learned a few things from this video. I mean, from this this episode. I didn't record my face today. Kind of upset because I wanted to wear pink, but it's okay. And please be safe out here. Seeing it's ready to get dark a little bit early, but that's okay. That's all right. Be kind to one another. Please protect yourself at all costs. Please display nothing but good vibes, and also be a helping hand to others. As always, you guys will hear from me next Wednesday. Bye.